Hey, everybody, welcome back to Around the Emirates podcast with Sara Mousa, where I speak to guests from across UAE about topics you want to hear about. Today, I'm going slightly internationally to speak to Dr. Fadi Hamadani, who is a plastic surgeon. Hello, Dr. Fadi.
Hi, Sarah. Thanks for having me on your show.
Thank you so much for being here. I'm super excited to talk to you about everything plastic surgery. So please tell me your story. What inspired you to become a doctor, and what does a typical day of a surgeon look like for you?
Sure. So I'm a Palestinian. I was born to a Lebanese father and a Palestinian mother on an island called Cyprus. It's a Greek island in the Mediterranean, and had most of my childhood there. And while I was living there, my father was diagnosed with a brain tumor, and he eventually succumbed to that. But that was my first sort of exposure into the world of medicine. And having been by his side and sort of going through that journey with him and seeing the impact it had on us as a family, but also interacting with his healthcare practitioners and his caretakers, instilled in me a sense that this is what I wanted to do. And having then moved from Cyprus to Canada for a few years and then back to the Middle East, I ended up experiencing several conflicts or wars, and was quite involved during those episodes in my life. I would volunteer at different hospitals or in refugee camps, and always felt like I wanted to be able to offer more to the victims of conflict, and to be able to serve their humanity, and then it was just a question of how to do it. And then, in high school and university, fell in love with the topics of science and physiology of the body. And I generally like to think about cases, and I like to solve them. And so I was inspired to become a doctor. And then from there, it's really just a question of where do you feel your personality and your skills serve you the best. And I felt like something surgical, or being able to deliver excellent results and improve people's functionality as well as their aesthetic, really resonated with me. And so I decided to pursue a career in surgery, and then subspecialize in reconstructive as well as cosmetic surgery.
That is very cool. And I really appreciate the fact that you shared something so personal about your father. I appreciate the fact that that was an opportunity almost out of something so tragic, but that you were able to, it was almost a catalyst in your head for like, this may be my calling. So it is a beautiful thing that you were able to create something so important that helps people out of that situation. And I mean, you just said yourself that it just developed a passion for you throughout kind of high school with your biology and just having a keen interest in that space. Um, how does it work in terms of your speciality and actually learning how to be a plastic or cosmetic or reconstruction surgeon in specific?
Yeah, for sure. So it's very different depending on which part of the world you're from. I went to medical school in Canada, and even there, medical school is different. In a lot of countries, you can actually directly enter medical school from high school. In Canada at the time, and I think it's still the same. I haven't been to Canada in years, but you can't enter directly from high school. You have to do an undergraduate degree, and then there's some exams you have to write and some interviews you have to go through. So it's generally a more mature crowd that enters medicine. It's considered a professional specialty. So I did it that way. And then after that, you have to land what's known as a residency. I landed a residency in general surgery at McGill University. And the first 2 years are considered surgical foundations. All of the different surgical specialties start off learning the basics of basically how to suture, how to diagnose surgical physiology, when it's okay to do a surgery, when it's not, the most common diseases. You learn to think as a surgeon, not just to operate. And then the years following that, you learn how to operate. I completed that successfully. I wrote my board exam there. It's called POS. I passed it. And then I spent about 4 years as a senior resident, and I had multiple roles at the time. I was doing research. I was also working as a senior resident clinically. But it wasn't truly what I wanted to do. And Canada, I love Canada, and I was very fortunate to have experienced many of my best days in Canada, and to also learn in that great educational system. But it wasn't really where I wanted to end up. I've always been sort of a Mediterranean leaning kind of person. I wanted to be closer to my family. So I decided to leave Canada and not continue my specialization there. I mean, I had the degrees that I had and the things that I had completed. And I actually sought out what's known as a competency-based training. So I would actually spend time in different countries working with different people who are specialists in certain areas. So my training was very niche very early on. So I spent a lot of time in South Africa for burn reconstructions. I spent time in Australia with different specialists. And I spent time as well in Tunisia and also in my home country of Palestine, just honing my skills. And I went back to Canada and North America a few times just to spend, some time with specific people. I spent some time in Italy as well and in France. So at the end of the day, when I felt all of my skills were honed and I felt confident to start my own practice, I came back home and I got the necessary licenses here and the necessary certificates. And I set up a shop in 2017. So it can be a very whirlwind type of journey. In some other experiences, it's a bit more linear. You sort of just go to med school, do your residency, finish, and then build up your resume and your experience. But I've always been somebody who loves the international flavor of medicine. I think medicine has values that resonate amongst many different countries and cultures. So I always wanted to gain experience in different areas. And luckily, and very fortunately, over the last 7 years, I've actually established myself as a bit of an expert. And I'm very honored now and fortunate to work with a great company called InMode. And this is really a company on the cutting edge of surgical technologies and is really introducing solutions for a very large number of people who aren't necessarily ready to undergo a classical surgery or an excisional procedure. And over the years, I've built a lot of experience and expertise in this. And now I'm what's known as a key opinion leader.
Wow, that's amazing. You actually get to like teach your teachers as well.
Yeah, these are people I still learn from, of course, and I learn from the colleagues I'm able to teach as well. But in certain areas where I've built a lot of expertise, I'm able to share that knowledge, and I like to have like an open door policy. So I get contacted from colleagues, literally from around the world, and by colleagues from around the world, and we discuss different cases and questions and so on.
That's so
So it's
cool.
really it is very cool. I'm very fortunate and lucky for that. And these experiences opened more doors for me a few years ago, and I started to get involved a little bit more in academia. And I love to teach. I'm very lucky that I'm able to teach. I have a family that's very supportive and of
Oh,
that. So looking forward to continue with that and to continue to build these experiences that at the end of the day are designed to make people's lives better.
that is so beautiful. I love that you're always thinking about helping people be better, helping make their lives better. It's a very like you're constantly thinking about how to pass on that knowledge, how to pass on that wisdom, that expertise. So that is such a beautiful thing. And I would just love to know, what does
Yeah.
a typical day for a plastic surgeon look like?
Oh, that's going to be very, very different from one surgeon to the next. So I have colleagues whose practices are purely surgical. This means that they will have a day or two a week where they'll see patients, and then the rest of the time they're just operating. And during their free time, they have family time and personal time, but they also professionally travel to conferences to keep their skills up and so on. My practice is a bit different. I do, again, you have to adapt based on the market and the society that you live in. So I live in a society that's still developing, and we have a lot of let's say complications or difficulties in our day-to-day life just based on the politics of the area and the situation that we face.
Right.
So I had to adapt quite a bit. There is a surgical demand here, but it's not huge. So I do have a very good surgical practice, but I also have a pretty significant amount of my time doing what we call non-surgical things. And so more and more we're realizing, especially in the field of cosmetic surgery or aesthetic medicine, that people are not as keen to have necessarily a surgical procedure, or they're not necessarily at the age where they feel that that's appropriate, or they just don't like the idea of things getting cut out of them, or having to open certain body parts up to do an operation. So the struggle for the last 20 years in our field has been, how do you develop technologies or treatments that can offer good results without necessarily the same level of invasiveness as an operation? And that's sort of the stuff I was talking about earlier with being involved with InMode and some of these emerging technologies. So my practice is really like this. So 50% or 60% of it is non-surgical. So I see a lot of patients with acne scars. This can be something that
Mm.
disfigures patients and creates a lot of social stigma. So these are very difficult to treat, especially in my population, because my population tend to be more ethnic skin types. They're darker skin types. So they don't have the same options to undergo aggressive treatments as, let's say, some of the European populations or the lighter skin types. So we have to really be creative and figure out ways where you can combine different technologies and to give them the best results. I also see a lot of non-surgical aesthetic patients. So people are interested in improving their facial structure and their skin quality without doing anything that's too aggressive. And I do a lot of reconstruction as well. So I'm a bit of a scar guy. I like to do a lot of burn scars and other scars. So that's a lot of work and requires lots of follow-up, and you need to have a very good setup. So you have to have very good equipment and a lot of experience and skill in dealing with that. So my clinic operates mostly for that reason. Plus I see the follow-ups of the different kinds of surgery. And I operate about once a week. And then the remainder of my time, I'm traveling. I'm traveling literally all over the world, mostly with InMode. I also travel with a company called Mertz, which is a great German company, very, very strong company in the aesthetic field, and they have some great products as well. And I'm faculty at a bunch of other groups and organizations, so I get to travel with them as well, to teach and to lecture and also to interact with colleagues and so on. So that's basically
I
how
love
my day
that.
will look like. Yeah, and I'm a take it easy kind of person, so I was never one to want that, on edge, adrenaline filled lifestyle constantly. As I've gotten older now, I kind of want to settle down more and take it easier. So I start work at noon.
Really
I don't
taking it
start early.
easy.
Yeah, I like to wake up in the morning. I like to spend time with my daughter. I live in a nice area here in a city called Ramallah, so it's very hilly and has some beautiful nature. So I like to sit on the balcony and just enjoy that and take it in. And then I go to work around noon and I work for 4 or 5 hours only, and then it's family time after that. So surgical days can be a little bit longer. I travel quite a bit, as I mentioned, so I need to compensate for that. So I like to keep the day very kind of short and efficient. And another thing is I don't like to operate on a lot of people on the same day. So I like to have 1 or 2 cases only. I find that keeps my skills up. I'm able to offer good results, but at the same time, I'm not rushed or under pressure, and I'm able to give every patient, the attention they need. Now, if you ask some of my colleagues, their days are going to be completely different. Some of the reconstructive plastic surgeons, the people who are doing what we call free flaps and dealing more in breast cancer reconstruction and trauma, they'll have busier schedules and they'll have nights on call, and it'll be much tougher. So I salute them and my hat's off to them, because it's a lot of hard work. So I'm a bit luckier. I get to have a little bit more of the balance. And again, you have to just see what you like and kind of build on that.
I love that. I mean, you've said so much that really almost it shows how much passion you have for your job. It's not for you. It's not just like a 9 to 5. I mean, it's sorry. Let me rephrase. That's not a 12 to 5
12 to 5.
But I love how
Yeah.
passionate you are. I love how you are. You have to think outside the box to help find solutions for patients that may not be typically available. And I like the fact that you are doing something that balances family time. And I know that there are people out there, I'm sure there are people out there that are trying to or aspiring to be plastic surgeons, trying to
Yes.
get into the medical field, but may not be too sure about taking the risk. What would your word of advice be for them?
Look, honestly, it's a fantastic specialty, but like anything that has a lot of responsibility in it, it's going to require quite a bit of sacrifice. So the first question any aspiring physician needs to ask themselves is this what they want? To be able to get to a point where you're an independent consultant and to try to start to have a bit more control over your life in terms of where you work and how long you work and so on, you have to go through a very rigorous training program. And these rigorous training programs actually require quite a bit of sacrifice. Okay. During residencies and medical schools, you will not have the freedom that I'm able to now enjoy. And you won't have that freedom for a long time, especially in a surgical residency, where I remember, some weeks I literally didn't go home. It would be, Monday to Monday of just being on call and then post call and resting at the hospital because I was on call again the next day and just working very difficult
Wow, it's
cases and
intense.
things. Yeah. I went through the Canadian system, which is, a great, great, great system, but also one that is understaffed. And it's a universally public healthcare system. So we were constantly busy and had full operating rooms and full emergency rooms and so on. So it was very difficult, and I couldn't do it again. I'll be honest with you. I mean, now at my age, going back to a younger age, yeah, I'm sure I had the energy and the motivation to do it. So they need to understand that there's a lot of sacrifice that has to go in. Surgery, particularly, as opposed to the rest of medicine, it requires some skills and it requires you to really practice. In fact, I'll share with you an interesting point. More than 70% of the life-saving surgery that is occurring in the world at this moment is not being performed by surgeons. It's actually being performed by medical officers. So in many of the low-income countries, they don't have enough surgeons to actually treat a lot of their emergent diseases. And many patients with, let's say, appendicitis, or who needs an emergency C-section, or has a fracture that needs to be operated on or set, they're being operated on by what we call medical officers or surgical officers. So these are people who came out of high school, did 2 years of training, and then started to really advance surgeries because it's the only option they have. I worked a lot in Africa. I spent a lot of time in Tanzania and in Mozambique and in South Africa, as I was saying earlier. And I learned as a medical student and in my early years of residency, I learned to perform most surgeries by spending time with a lot of these surgical officers. These are people who didn't go to med school and actually don't hold the title of doctor. And they are phenomenal. I mean, they are so resourceful and brave and working in very difficult conditions. So surgery, it's a vocation. It's not like the rest of medicine. You need to practice. And the more you do of something, the better you become at it. And it takes a lot of bravery to be able to cut into a human being and have a responsibility for that person. And then to also feel confident enough that if something were to go wrong, you would be able to fix it. So the first question is, any aspiring surgeon needs to know that, right? You have to be a very, very good surgeon. You have to go through all the training. You have to have the long nights. You have to sacrifice a lot of friendships and family time to be able to get to that point. Once you get to that point, though, and you're at the level where you can start honing your skills into specific areas and fellowship training and so on, you gain a lot more freedom and a lot more responsibility as well. But life becomes a little bit better. You can start setting up the kind of practice that you want. You can start developing expertise in the areas that you want as well. And then things start to open up a little bit. So as long as they're aware of the journey overall, I think it's a great, great area. There are many challenges facing us now, especially with what's happening on a global scale in terms of social media and the influence it's having on people's perception of themselves. We're seeing much higher rates of what we call body dysmorphic disorder, and people made to believe that they need to have a particular treatment, or they need to follow this influencer style in order to have value or to be worthy. And these are very dangerous concepts that are starting to impact people on a multitude of levels. And what we're seeing happening is people without the appropriate training or the appropriate background are starting to come into this field and are starting to offer dangerous and let's just say unwise treatments and solutions to patients. And so we're seeing distortions of how people look, and we're seeing a lot of complications and side effects from this. So I think cosmetic surgeons or aesthetic physicians who have the appropriate background, have sacrificed a lot to be where they're at, feel this encroachment happening on their areas of specialty and expertise. So there are some challenges out there, and I think we need a new generation of physicians who can really work through that, defend the turf, so to speak, make sure that people are getting the appropriate treatments and that they're propagating the right ethics around these kinds of treatments. And in terms of reconstruction, for those who are more interested in the reconstructive field, there will always be a need for that. Always be a need for that. Yeah.
Thank you so much for sharing all of that, Dr. Fadi. I learned so much just understand the different types of plastic surgery that you just gone through. And it, like you said, like the sacrifices and knowing that it is such an important, it's not the easiest job to do, but when you learn how to do it and when you learn and when you can figure out how to help people in that way, like especially with something as important as someone's like appearance, for example, like that does make a world of difference in making sure that you are doing your job for the community and doing something that also fulfills you as a human. And I'm really grateful that I got the chance to share your story today. Thank you so much.
Thank you so much. I really appreciate it, Sarah. Thank you.